Okay, so hi guys. So for this discussion, we will proceed with the enzymes of clinical significance. So for the last module, we already discussed the different factors affecting enzyme concentration, including the inhibitors like competitive, non-competitive, and uncompetitive inhibitors, as well as the importance of the um, tubes that are to be used for enzyme determination, and of course the we prefer serum, either that is collected in red top non-additive or in yellow with a gel separator. Okay, so for the first enzyme, but before that, take note again, guys, that enzymes they are critical regulators of human diseases. Okay, because absence of this enzyme would result to a lot of disorder. Okay? So maraming disorder na mag-appear if there are deficiencies in enzymes like in the G6PD. Okay? Even in Gaucher disease, which is because of the absence of enzyme. If you remember, also we have the Gilbert's and Krigler-Nagar syndrome, wherein these are caused by the mutation of enzyme. Okay? So, in addition, as biomarkers, some enzymes often present consequential cue about the disease state due to their corresponding altered pattern in the tissues and serum. So, just like CK, creatine kinase, AST, and LDH, wherein their concentration are altered in acute myocardial infarction, the AST, the ELP, in liver, the ELP, also in bone. Okay, though they are not specific. Okay, they are not specific. No, they are not sensitive. Okay, they are not sensitive and specific for a certain organ because enzymes are present. Okay, in various organs. They are not confined only to a specific cell or to a specific organ. However, we can still use them in clinical diagnostics in the laboratory methods to increase the likelihood for the diagnosis of certain diseases. Okay, so this chapter will provide us with a brief overview of the current paradigm on harnessing the clinical utility of enzymes with potential impact in the diagnosis of cancer disease, okay, myocardial disorders, and gastrointestinal tract related impairments, hepatic disorders also. Okay, so let's start with creatine kinase. So creatine kinase, its purpose in the body that is for the ATP regeneration in contractile or the transport system, and that is involved in the storage of high energy creatine phosphate. So this is the reaction that is catalyzed by creatine kinase. We will not mainly focus on their function but on their alteration in case there is a disease or there are diseases resulting to increased level of the CK. Okay, so the CK creatine kinase, that is, its highest activities or the highest concentration are found in the skeletal muscle, heart muscle, and the brain tissue. Okay, so skeletal, heart, and brain. So, however, guys, smaller quantities are also found in various organs. Okay, so it is not only confined on these three, but the highest concentration are found in these three organs. Okay, so most likely the highest elevation, okay, or you will expect higher elevations on the enzyme concentration if the skeletal, the heart, and the brain, no, the skeletal muscle and the heart muscle are damaged. Okay, why did I not include the brain tissue? So we'll discuss that later. Okay, because of the presence of blood-brain barrier. Okay, so it cannot, even if there's a damage on the brain tissue, it does not, okay, it does not go to the circulation unless the blood-brain barrier is also destroyed. Okay, or sobrang malaki yung damage ng brain cells resulting to the appearance of CK. the isoenzyme into the serum or in the circulation or in the plasma. Okay, so we proceed with the diagnostic significance of the creatine kinase. So, elevated since the CK are found with highest concentrations. Ano ulit ang highest concentration ng CK, guys? Okay, saan? Sa skeletal muscle, sa heart muscle, and sa brain tissue. Okay, pero sinabi ko na kanina that elevations of CKDV, okay, or elevations due to brain injury does not likely occur unless, okay, there's a great damage in the brain tissue and the blood-brain barrier is not functioning well. Therefore, elevation can be seen in cardiac and skeletal muscle. Okay? So, cardiac at skeletal muscle. So, in skeletal muscle disorder, what are okay, or what are the skeletal muscle disorder wherein the CK is increased? So, of course, we have there the acute myocardial infarction. Okay, aside from that, rhabdomyolysis as well as in muscular dystrophy. Okay, so it is considered as, take note of this, sensitive indicator of AMI and muscular dystrophy. Guys, what is the difference between sensitive and specific when it comes to clinical diagnosis? Sige nga, if you remember. Okay, when we say sensitive, that is the ability of the test to correctly identify, okay, those with the disease. Okay, i-identify sensitive ang isang test method kung kaya niyang i-identify yung mga taong meron talaga yung sakit na yun. Okay, so true positive ang kanyang dinedetect. On the other hand, for specific, that is the ability of the test to correctly, okay, identify those without the disease. So, si sensitive it detects individuals who are positive for that disease. For specific, it detects individual, okay, or it has the ability to correctly identify if the patient does not have a disease. Okay? Therefore, since sensitive dito is for positive, okay, for positive patient, increase, okay, an increase in CK would possibly mean, but not always, okay, would possibly mean that there is acute myocardial infarction. Okay? So, kung tumataas siya because of a damage in the heart tissue, definitely, okay, sensitive, definitely nagiging sensitive yung measurement niya. Okay? Kasi yung increase niya is because of the acute myocardial infarction. Okay. So, guys, paano niyo maaalala na si sensitive? It defines the capability of the test to determine individuals who really have the disease. Okay? Yung positive sa disease. Sila mismo merong disease that is for sensitive. Like, ewan ko if it will help you, but I hope. Okay, so we have here a pregnancy test kit. However, hindi pala siya ganun maganda. So that is pregnant and non-pregnant. Remember this one. This is positive, right? So, positive. Ang mga buntis, okay, ang mga positive, so ang mga buntis, ang mga confirmed na buntis, they are sensitive. Okay, so just for you to remember that sensitive, okay, is the ability of the test. Sensitivity of the test refers to the ability of the test to detect true positive. Okay, those individual who really have the disease. On the other hand, is specific, it is the ability of the test to measure true negative. Okay, so true negative for specific, true positive for sensitive. Okay, specific, true negative, sensitive, true positive. Individuals who really have the disease. So, tago muna natin. So, take note guys that CK vary with muscle mass. Okay, so what does that mean? Therefore, okay, therefore, the higher the muscle mass of an individual, the higher also the CK level. Okay, or the more an individual is active in exercising, it will also reflect in his or her CK level. So, mas mataas din. Okay? So, the CK level may depend on gender. Okay? So, mas mataas sa lalaki kaysa sa babae. Race. So, I read something about this. Compared to white American and Black Americans have higher levels of CK, degree of physical conditioning like exercising, okay, or yung daily routine mo. So, the more the activity that is involved, or yes, so pag mas active ka, more likely mas tumataas yung CK level mo as well as age. Okay? So, if you compare children with adults, okay, mas mataas sa adult. Okay, so diagnostic significance, CK and progesterone ratio is also useful in determining or in the diagnosis of ectopic pregnancies. CK to progesterone ratio is useful in the diagnosis of ectopic pregnancies. What do you mean guys by ectopic pregnancies? Okay, bakit ectopic? When the egg is fertilized outside the uterus. Okay, kaya siya tinatawag na ectopic, outside the uterus. So, separation of total CK. Oh, wait. So, because of the enzyme elevation, okay, because enzyme elevation in CK is found with numerous disorders, kasi it does not only increase in skeletal muscle disorder and in AMI or cardiac muscle disorder, but as well as the disorders of other organs as long as the CK is present. Okay, so therefore, the separation of total CK into its various isoenzyme fractions is more specific indicator. Okay, mas nagiging specific siya kapag ang ginamit mo is the isoenzyme. Okay? So, isoenzyme yung basis mo. So, clinical relevance of CK activity depends more on isoenzyme fractionation than on total levels. Okay? However, guys, we don't really, in simple laboratories, we don't perform isoenzyme fractionation because that is more expensive. Aside from that is more expensive, you can use doctors can use inexpensive method to detect disorders of other organs, okay, without using isoenzyme fractionation. Kasi may mga signs and symptoms, diba? Okay, aside from that, meron pang X-ray, okay, meron pang ultrasound, there are other tests. Okay, so isoenzyme fractionation is not commonly performed in clinical laboratories. Okay, but for the sake of theoretical knowledge, kailangan pa rin natin siyang i-discuss. Okay, elevation still with CK. Extreme elevations in Duchenne type of muscular dystrophy. Okay, so I don't know why, pero ito yung hindi ko nakakalimutan. I found this word very interesting. Diba? So, Duchenne type of muscular dystrophy, it involves extreme elevation of CK that is 50 to 100 times the upper normal limit. Okay? Or the upper limit of normal. Okay? So, ano ibig sabihin ng upper limit of normal? For example, okay, so example lang na, if the reference range of CK is 50 to 200, okay, in Duchenne type of muscular dystrophy, since example lang muna, 50 to 100. Okay? So, 50 to 100 ang kanyang reference range. So, i-multiply mo yan ng eto kasi yung upper limit of normal, yung 100. So, 100 times 50 or 100 times 100, yun yung mga possible na level ng elevation for CK in Duchenne type of muscular dystrophy. So, 100 times 100, diba? So, 10,000. So, kapag umabot na yun ng 10,000, 50 times 100. So, 5,000. Example lang guys because that is not a definite reference range. I'm just giving you an example in numerical value for you to understand it better. So, elevations of 50 to 100 times the upper limit of normal, kunwari in our example, tumaas siya ng 5,000 to 10,000. There's a possibility that that is Duchenne type of muscular dystrophy because of the degree of elevation. Okay? So, but guys, take note that it is not entirely specific. Okay? It is not entirely specific indicator as CK elevation is found in various disorder. Diba? So, it's not specific for Annie, it's not specific for Duchenne. Okay? Because that is also increased in mga cardiac disorder and skeletal muscle condition. Okay? Okay. So, elevation still with CK, yung mataas na level ng CK, that is occasionally elevated in CNS disorders. Okay, ano yung mga CNS disorders? Stroke, okay, seizure, nerve degeneration, and CNS shock. Okay? However, guys, even in those CNS disorders, damage to the blood-brain barrier must occur to allow the enzyme to release in the peripheral circulation. So, kahit nagkaroon ng CNS shock, okay, nagkaroon ng nerve degeneration. What do you mean by degeneration, guys? Nag-deteriorate. What do you mean by nag-deteriorate? Nagka-loss of function or lesser activity. Okay, yung nerve kasi that is nerve degeneration or at times of seizure. Okay, so even in those CNS disorders, okay, so it is not likely the CK does not likely increase because of the blood-brain barrier. Okay, so sa blood-brain barrier kasi it prevents the entry of substances in and out of the brain. Okay, so hindi rin basta makakalabas si CK. So, hindi niya maia-affect yung elevation na nangyayari sa peripheral circulation. Okay, sa circulatory system. So, kung hindi yan affected, hindi din tataas yung level ng CK na i-measure mo sa laboratory during or kapag merong CNS disorder. Okay, so yung mga CNS disorder, they are not, the CK level does not reflect, right, the presence of CNS disorder unless, okay, unless the degree of tissue damage in the brain, okay, is really big. Malaki yung damage sa brain and nasira yung blood-brain barrier. So, in that case, tataas talaga yung level ng CK. Okay? Pero hindi rin ganun kataas. Aside from that, CK is also elevated in hypothyroidism. Okay? Hypothyroidism in malignant hyperpyrexia. Okay? What do you mean by hypothyroidism? Low levels of thyroid enzyme. Okay? Nagkakaroon mababa yung level ng mga thyroid enzyme natin. What are the thyroid enzyme? We have the T3 and T4. So remember in our biochemistry. What do you mean by malignant hyperpyrexia, guys? It is the fast rise in temperature due to what, guys? Due to general anesthesia. Sobrang mabilis ang pagtaas ng temperature as well as there is severe muscle contraction. Okay? Kaya tumataas siya because of the severe muscle contraction and sobrang elevated pa ng temperature. Okay? How about Ray's syndrome? Na-encounter na natin ba to? Yes, in our discussion with the bilirubin. So, what is affected in Ray's syndrome, guys? Ano yung nag-elevate? Is it the non-polar bilirubin or dipolar bilirubin? Bipolar, deconjugated. Kasi di ba nasa last part po, if you remember, the post-hepatic jaundice. Okay, so we proceed with the different isoenzymes of the creatine kinase. So we actually have three. Di ba na-discuss na natin ito dati? We have the BB, okay, your BB, chong, okay, the CKBB, which is also known as the CK1. So that is BB. Okay, nandyan naman na, that is the brain type. Okay, BB, that is for brain type. Okay, sa in CKMB naman, which is the 2, okay, CKMB, pinaghalong M at saka B, kaya siya hybrid type. That is the CK2. And the CK3, that is MM, muscle. Okay, so makikita talaga siya in the muscle. That is the CK3, which is known as the muscle type. Okay, we go back to the isoenzyme 1. Okay, the BB, CKBB, that is the brain type, and that is present only in small quantities. That's why you cannot measure it. Okay? You cannot measure it in the peripheral circulation. Hindi ito basta na-measure sa serum. Okay? Because of its very low level. Okay? So, since the CKBB is present in small quantities, okay, and because of its short half-life, which is 1 to 5 hours, results in CKBB activities that are generally low and transient, okay, and therefore it is not measurable when tissue damage occurs. So, yun yung sinasabi ko kanina. Okay? Why? Because that is present in the brain. And relative to CKMB and CKMM, sobrang konti ng quantity niya. So, hindi siya basta na-measure, hindi naman siya basta nakakalabas from the brain. Okay? Though the CKBB is not only confined to the brain type, it is also found in other tissues. Okay? Pero relative kasi talaga to other CK isoenzyme, it has a very small quantity. Okay? So, because of this small quantity and short half-life, it is not usually measurable. Padaanin natin. Okay, so it is not usually measurable in the serum. So, nandito pala, not usually measurable. Okay, even when there is tissue damage. So, the serum mainly contains CKBB of brain origin. Bakit, guys? Because of the what? The blood-brain barrier. So, hindi siya basta nakakalabas because of the presence of the blood-brain barrier that inhibits the release of the isoenzyme CKBB to the peripheral circulation. Okay, so tissue sources of the CKBB, highest concentration in the CNS, central nervous system, as well as the gastrointestinal tract, and in uterus during pregnancy kapag buntis. O, sino ang mabubuntis? Naku, baka si ano, baka si mom. Char. Okay, so the CKBB or the CK1 that is also elevated in carcinoma of various organs. Okay, what are the carcinoma, guys? Ano kaya ang carcinoma? That is a cancer that starts in the cells making up the skin and the tissue lining the organs. Yung ibig sabihin ng carcinoma. Okay, type siya ng cancer. Okay, that starts in the skin or in the tissue lining. Okay? So, untreated prostatic carcinoma and other adenocarcinoma. So, ano napansin nyo, guys? Tumataas si CKBB sa mga cancer, okay, sa carcinoma, prostatic carcinoma, and other adenocarcinoma. Therefore, the CKBD may be useful in tumor associated, or the CKBD may be a useful tumor associated marker. Okay? So, pwede daw siyang maging tumor associated marker. Okay? However, yun nga, very low level lang sila. Mahirap i-measure. Okay? So the most common causes of CKBD elevations are CNS damage, tumors, childbirth, and the presence of macro-CK. So ito yung macro-CK. That is a CK with immunoglobulin. Okay? So, CK complex with immunoglobulin. Okay, we proceed with the CKMB. Okay, or the CK2. That is the hybrid type. Hybrid type. It contains the polypeptide M and the polypeptide B. Hindi kagaya ng CKDB. Parehong polypeptide B. Okay? So, that is undetectable to trace. Less than 6% of the total CK. Therefore, the majority of the CK that is measured in our serum, okay, is the CKMM or yung CK3. So that is important also for the detection of the myocardial damage. Why guys? Kasi meron siya sa heart. Okay? Tissue sources of the CK can be cardiac tissue and small quantities in other tissue. So myocardium is essentially the only tissue from which CKMB enters the serum in significant quantities. Kaya, okay, therefore, the CKMB is really important in the evaluation of ANI. Okay? Pero it does not necessarily mean na kailangan mo i-separate into fractions ang CK. Okay? When it comes to the diagnosis of ANI. Later on, you will realize kung nag-med school, nag-ano na kayo, schooling sa med school, nasa medicine na. The CK, though grabe natin siya di-discuss dito, hindi naman siya ganun ka-importante when it comes to acute myocardial infarction because there are more sensitive method using the troponins. Okay, the troponin I and the troponin T. Okay, next slide. So, 6% of the, that is greater than 6%, dapat yan. Okay, so slide 13, greater than 6% of the, greater than or equal, sorry, mention naman. Greater than or equal to 6% of the total CK is considered a good indicator of AMI, acute myocardial infarction. Guys, ano ba yung AMI? Nagtaka na ba kayo kung ano yung AMI o yung acute myocardial infarction? That is heart attack. What's the difference between heart attack and stroke when it comes to organ involvement? C, AMI or heart attack involves the heart. For the stroke, it involves the brain. Oh, alam niyo kaya yun? Sana, di ba? Well, ngayon, alam niyo na kung hindi alam dati. Okay, so following myocardial infarction, the CKMB levels begin to rise. Okay, within 4 to 8 hours. So you have to remember this. Okay, and you have to compare them with the rise of EST as well as in the LDH. Okay, memorize na natin. Si CKMB, tumataas within 4 to 8 hours. Okay, begin to rise. Peak level at 12 to 24. And it normalizes within 48 to 72 hours. Okay, so tatlo yun. Tatlong range yun. 48 hours, 12 to 24 hours, 48 to 72 hours. So, do not forget that CK and the elevation during acute myocardial infarction. Okay, so still elevations of the CKMB, guys. So the CKMB activity has been observed in other cardiac disorders. Therefore, it is not entirely specific for AMI, but probably reflects some degree of ischemic heart damage. Okay? Wait lang. Okay, guys. So remember this one that the elevation of CKMB is not entirely specific for AMI. Okay? So the specificity is increased with conjunction of LD isoenzymes and or troponins and it measured sequentially over a 48-hour period. Okay, so however, guys, these days, the diagnosis for heart attack or acute myocardial infarction relies mostly with the use of the troponin. Okay, so yun yung nire-request talaga most of the time if they want to assess episodes of heart attack, the troponin. Okay, so um, so from that, wait lang. So we have the troponin T and the troponin I. So these are non-enzyme proteins that have been used as more sensitive as well as they are more specific. Again, pag sensitive, true positive. Okay, kasi ang mga positive ay sensitive. Okay, para maalala nyo. And specific, that is true negative. So the troponins are more sensitive and more specific in myocardial damage as compared to the use of enzymes. Okay, because, bakit kaya mas sensitive sila? Because they are released in the bloodstream earlier. Okay, mas mabilis silang nare-release sa bloodstream and they persist longer. Okay, mas matagal silang nag-i-stay, mas matagal silang nag-i-stay as elevated as compared kay CK. Okay? So, nagkakalimutan ang ating mga troponins. Okay, so we go to the third isoenzyme of the CK, the MM, and muscle. Okay, muscle type, that is the CK3. So that is the major CK isoenzyme that is found in the human sera. So majority of the CK that is measured in the serum of an individual reflects the CKMM. Okay, so I hope that is clear. So tissue sources, the striated muscle in the normal serum. So aside from that, SM refers to skeletal muscle, okay? So SM almost entirely CKNM with a small amount of CKNB, okay? So kaya pinakamadami ang CKNM. Kasi nga, yung mga skeletal muscle, they have the CKNM isoenzyme. Okay? And imagine, relative to the heart muscle and to the brain tissue, syempre, si skeletal muscle yung pinakamalaki. Okay? So, this skeletal muscle has also a very small amount of the CKNB. So, normal serum has approximately, I think this should be, tama, 94% to 100% CKMM. Ano yung naiwan from the 94? The 6% or the less than 6% of, diba? That is here. Less than 6% of the total CK. Yun yung mag-fill sa percentage na to. So, pinakamadaming concentration ng CKMM followed by the hybrid type MB. Lastly, pinakakonti si CKBB. Okay? So we proceed with the elevation. Majority of CKMM elevations, those are because of injury to both the cardiac and the skeletal muscle. Okay? So in hypothyroidism, it also results in CK and M elevation. But in the hypothyroidism, the levels of thyroid enzyme. Bakit kaya tumataas ang CK, MM, kapag may hypothyroidism, this is because of the increased membrane permeability. Okay? Mas mabilis ang paglabas at pagpasok inside the cell. Therefore, mas mabilis makalabas yung CK. Okay? Nakukuha? Mild to strenuous activity, even in intramuscular injection, results to elevation of the CKMM. Okay? Tumataas sila. Bakit again? Bakit in strenuous activity? Okay? Because of the use of or the muscle mass. Okay? So, if you remember yung quiz natin, bakit mas mataas ang CK? Okay? Anong factor yun? Because of the increase in enzyme activity. Okay? Kailangan ng mas maraming enzyme kapag mas marami kang ginagawang exercise. Kasi pinapalaki niya yung muscles mo. Okay? Aside from that, in intramuscular injection, bakit kaya tumataas yung level of CK when there's intramuscular injection? Take note guys, in intramuscular injection, you damage the muscle cells. So, if you damage the muscle cells, kasi nga, papasok ang pagpasok mo, diba? So, if you damage the muscle cells, what will happen? So, the enzymes that are present inside the muscle cells will be released in the circulation. However, guys, take note of this one. For strenuous activity, levels may be elevated, okay, as long as 48 hours following the exercise. So, kapag katatapos din mag-exercise, lalo kapag masyadong grabe or mabigat yung exercise, tumataas siya and it persists until 48 hours. Okay? In the intramuscular injection, okay, the CK elevation are less than 5 times of the upper limit of normal. Okay, and it is not usually apparent after 48 hours. Okay, although the elevation may persist for 1 week. Mahaba ng ibig sabihin nun. It means that after intramuscular injection, okay, so the degree of elevation is lesser than 5 times than the upper limit of normal. Okay, and the increase can only be apparent, okay, and is usually apparent only after 48 hours. So, parang 2 days muna. It will take 2 days para makita yung elevation ng CK. So, for example, nagkaroon na tusukan today. Okay? So, mga drug abuse, diba? Tusok, intramuscular. So, hindi naman agad tumataas yung level ng CK nila. It will take time. It will take around 48 hours. Of course, that is an approximate value. Okay? Okay, so, papakita ko buti pa siya nag-exercise. Elevation still with CKMM or the CK3. The degree of exercise is relevant to the elevation. Okay, so, and therefore, the most important factor in determining the degree of elevation is also the degree of exercise relative to the exercise capacity. Okay? Pero hindi naman masyadong importante yun. Basta, the degree of exercise, the more exercise, the higher the muscle mass, the higher the degree of elevation. Okay? And, again, ano yung sinabi natin kanina? It may persist up to 48 hours after the exercise. So, sobrang strenuous ng exercise, matataas yung level ng CK concentration in the peripheral circulation and may persist for 48 hours. Pinakita ko lang po siyang nag-exercise. Baka mahawa po kayo. May be elevated for until 48 hours. Okay, so less than 5 times of the upper limit of normal. So, sinabi ko na ito kanina, following intramuscular injection, it's usually nag-apparent after 48 hours. So, we have here two unusual CK isoenzyme, the macro-CK and the mitochondrial CK. So, again, sinabi naman na natin kanina, macro-CK, that is a creatine kinase complex with immunoglobulin. Okay, wherein in most instances the complex or the attached immunoglobulin to the CK is the IgG. Okay, but even IgA can form a macro CK. Okay, pero in most instances talaga si IgG yung form na nagko-complex kay creatine kinase. Okay, mitochondrial CK. So, the CK mitochondrial is bound to the exterior surface of the inner mitochondrial membranes of the muscle, brain, and the liver. Okay? So, yun lang, additional info. It's because these are also included in Bishop. So, kay Bishop ko kinuha yung discussion natin. Hindi ko na naisingit si Henry. I will check if I still have time to see informations that are not present in Bishop but are present in Henry's. Okay? Pero kung masipag naman kayo, di ba? Then check it as well. Baka hindi na ito binabasa si Henry's. Okay, we proceed with the second enzyme. So, the LDH or the LD. So, that is the lactate dehydrogenase. So, that is an enzyme that catalyzes the interconversion of lactic to pyruvic acid. And guys, also the lactate dehydrogenase or the LD or the LDH is widely distributed. Okay, therefore it is not again a specific enzyme. Okay, it is not organ specific. Okay, so high activities are found in the heart, sa puso, sa liver, sa skeletal muscles, sa kidney, at sa red blood cell. Okay, even WBC kasi tumataas din siya during kapag may mga leukemia. Okay, lesser amounts are found in the lungs, smooth muscle, and in the brain. Okay, diagnostic significance of LDH. Review what is the diagnostic significance for CK. Type 1, acute myocardial infarction. Okay, so yun pa din guys, kahit hindi naman so it's not commonly used. So by the book, yun na yung clinical significance, diagnostic significance. Okay, highest elevation in, saan guys? Highest elevation of CK. A favorite, Duchenne muscular dystrophy. For how many compared to the upper limit of normal? That is 50 to 100. Okay. Elevation, kailan tumataas si LD? Okay, guys, take note, kung saan siya nakikita, heart fever, skeletal muscle, kidney, or BC, damage to those tissues or cells will result to elevated concentration. Okay, as you can see, diba kanina sabi heart, increased levels are found in cardiac, in liver, okay, cardiac, hepatic, skeletal muscle, and renal diseases. Diba? Kasi din natin siya makikita, major concentration are found in, ano yung sinabi kanina? Heart, liver, skeletal muscle, and kidney. Let's check. Heart, liver, skeletal muscle, kidney, as well as in the RBC. So even in several hematologic diseases, including acute lymphoblastic leukemia and neoplastic disorders. Okay? So, what do you mean by, neoplastic disorders? It is caused by tumor growth. So we have here the ALL. So we will tackle this. Acute lymphoblastic leukemia in neurohematology. Okay. There are lots of topic under hematology kaya nakakalito. Okay, so we'll start with the cell, function of the cell, different cells in the blood, the different function, the different characteristic. And then you will proceed to red blood cell. Under red blood cell, meron kayong porphyrias. Okay, so, and then merong hemoglobinopathies. Tapos merong thalassemia. And then magpo-proceed ka ulit. Pagdating mo naman ng white blood cell, in anemia also, meron pang anemia. Di ba? Ay, in RBC, meron pang anemia. Pag pumunta ka ng WBC, meron kang leukemia. Okay? Wala pala kang leukemia. Merong topic na leukemia. Diba? Hmm, hema. Kaya guys, si hema ay kung si clinical chemistry ay nakakapag-asisi, di ba? Nag, nakakapag-asisi sa inyo. Si hematology naman ay nakaka-hematay. Char! Okay, kaka-hematay ang hematology. Okay, so balik na tayo guys. Konting ano lang. Konting charot lang. So highest elevations are found in pernicious anemia and hemolytic disorders. As you can see guys, saan ito? It is covered by hematology, but since this is a correlation, okay? So LDH or LD, its highest elevation is seen in pernicious anemia and hemolytic disorder. Okay? But even though yung pernicious anemia guys, in pernicious anemia, there's deficiency of red blood cell. Okay, kaya nga siya anemia eh. Mababa yung level ng red blood cell. Bakit mababa? It's because of vitamin B12 deficiency. So ma'am, pareho sila ng megaloblastic anemia. Hindi guys, iba kasi yung case ng megaloblastic anemia. In pernicious anemia, okay, there's a low level of RBC because of the low level, okay, or yes, the low level of vitamin B12. Okay, so yung low level of vitamin B12 is because of the absence of intrinsic factor. Ang dami naman no. Okay, mababa yung red blood cell count mo kasi konti ang vitamin B12 which is needed for the synthesis of red blood cell. Bakit mababa yung level ng vitamin B12? Kasi walang intrinsic factor o sobrang baba ng level ng intrinsic factor. Bakit ano ba si intrinsic factor? Okay, it is needed for the absorption of vitamin B12 in the intestine. So kahit sa pagkain, if you have vitamin B12 or even if you intake drugs containing vitamin B12 as supplements, if you don't have the intrinsic factor, that will lead to pernicious anemia. Okay? In hemolytic disorders, so tumataas siya because of the release of the LDH into the circulation. Okay, still, elevation that is, LD is also elevated in liver disease as well as in acute myocardial infarction. Diba? If you remember Kyle, okay, si LD sa question natin sa quiz mo, okay, baliktad kasi yun. The LDH is the last to rise, then AST, then CK. Okay, so that was the correct answer. Baliktad ko lang kasi yung sequence niya. So, si LDH yung pinakamatagal na mag-rise, yung pinakamatagal na mag-persist. Okay? Okay, review. For the CK ha, not LD, the level begin to rise at what hour from the onset of attack? That is 48. And then peak level at 12 to 24 hours and normalize in 48 to 24 hours. So, nag-peak pa lang yung LDH mo. Nag-normalize na yung CK. Okay? Yung LDH naman, mas matagal siya. Hindi mas matagal. The level begin to rise in 12 to 24 hours, peak at 48 to 72 hours, and still may remain elevated for 10 days up to 14 days. Okay, so it may remain elevated for 10 to 14 days. And guys, there are so many medical terms here that I did not define. Okay? It's up to you. Actually, pa-bonus na lang, dinidefine ko pa yung pernicious anemia, mga carcinoma. Okay, actually, that should be read already. So, para mas smooth yung flow ng discussion, mas naiintindihan mo. Discuss ko na, pero hindi ko na kaya i-discuss lahat ng nilililo. Okay, so I hope you do also your part. So, review again. How many isoenzymes does CK have? Tatlo. Ano yung tatlo? Ano yung CK1? CKBB, which is the anong type? Brain. CK2, which is the hybrid type, which is the CKMB. And the last is the CK3, which is the type, muscle type. Type kita. Char! Wala akong maisip. Okay, so that is the, nawala ako tuloy. That is the CK and MK or the muscle type. Ano-anong pakulo ng hematite. Kapag CC, type kita. Okay? So, balik tayo. So, in LDH, okay, in your case, ang diniscuss ko kasi is we have 6, diba? 6 isoenzymes, which is actually true. But there are 5 major, okay? When we speak of the major isoenzymes, we have 5 major LDH or LD isoenzymes. Okay? So, tanggalin na nga lang namin si LD. Though you will see naman in many books that LD is the same with LDH, but to be consistent with this one. So LD, there are 5 major isoenzymes. So kung ano si alcohol dehydrogenase. Okay, so there are 2 different polypeptide chains designated as the H and the muscle. Okay, so hindi kagaya kanina ng muscle and the organ, diba? For this one, heart and muscle naman for the LD isoenzymes. So combining 5 arrangement will be 5 major isoenzyme fraction, but I was not able to include here the combinations, but I will include that in the laboratory part. Medyo ang dami na kasi talaga. Okay, so imagine we're still on slide 24 out of slide 98. Nakakaiyak. Okay, so LD1 and LD2 are present approximately the same, okay, extent in the tissue. So almost the same concentration. In cardiac tissue and red blood cell, the LD1 is greater than the LD2. Take note of this one, guys, because we have the LD flip pattern. Okay, so take note of this one because we have the LD flip pattern. So, in cardiac tissue at saka sa red blood cell, okay, sa heart at saka sa red blood cell, mas mataas yung concentration ni LD1 kaysa kay LD2. In a normal serum, okay, in normal serum, in the serum of a healthy individual, yun yung ibig kong sabihin pag in normal serum, in this serum or in the peripheral circulation of a healthy individual, the LD2 is greater than LD1. Okay, kukuha. So, tandaan nyo na, in cardiac muscle, and in the red blood cell, the LD1 is greater than the LD2. In the serum or in the peripheral circulation of a normal individual, mas mataas ang LD2 kay LD1. Nakukuha niyo ba yun? I hope that is clear. Okay? So LD1 is relatively abundant in cardiac muscle, whereas the LD5 is more abundant naman in the skeletal muscle. Okay? So LD1 is not found in the skeletal muscles and liver. Okay guys, meron naman to kay Bishop. You check your books. You please read also your books even if I discuss almost everything already. Okay, actually this is spoon feeding. But I really understand that it's really hard for you to study on your own. Kasi mahirap lang talaga ang thinking. Diba? Okay? So, LD1 is not found in the skeletal muscles. But guys, please read also your books. Hindi yung nag-iinarte lang dyan sa gilid ng rulo. And then, pinupost nyo sa my story. Tapos, hindi nyo naman pala binabasa. Basa-basa din. Sayang din naman yung mga pa-sponsor kay mother and father. In AMI, okay, in acute myocardial infarction and intravascular hemolysis, the serum levels of LD1 will increase to a point at which they are present in greater concentration than LD2, resulting in a condition known as the LD flip pattern. Ma'am, ano ba yan? Ang haba. Ko naintindihan. Okay, so wait lang guys. Wait lang. I will explain it to you using the paint. Okay, yan. Nasa pink na tayo. Okay. Gamit tayo ng mas malaki. Yes, mas malaki. Okay, guys. Um, Balikan natin si LD1 and LD2. Okay? In normal, okay, in normal individual, in the peripheral circulation of a normal individual, okay, normal serum na lang ilagay natin. Okay? The LD2 is greater than the LD1. Tama. Bakit hindi mo na lang i-type? Kasi ano guys, hindi ko pwedeng gamitin yung mga yung sa keyboard ko kasi nandun yung mga shortcut function na ginagamit ko pang percent sa inyo. Baka mawala or makata naman. Okay, so in the serum of a normal individual, serum of normal individual, so kaasa, serum of normal individual, the LD2 is greater than the LD1. So I hope that is clear. Okay, in cardiac muscle, CN, in cardiac muscle and in, ano yung sabi mo kanina, erythrocyte, red blood cell, the concentration of LD1 is greater than the concentration of LD2. Nakukuha? Okay? Or not necessarily greater than. Basta in cardiac muscle and in RBC, sobrang taas. Okay? Yun na lang, para mas baka mas malito na naman kayo dito. Okay, delete. Delete. Okay? In cardiac muscle and in red blood cell, okay, mataas yung level ni LD1. Okay. So, if mataas ang level ni LD1 in the cardiac muscle and RBC, what will happen, okay, if we have hemolysis, either hemolytic anemia or intravascular? Diba kasi hemolytic anemia, that is a form of intravascular hemolysis. What do we mean by intravascular hemolysis? Hemolysis that occurred inside the body. Okay? Hemolytic anemia. Okay, hemolytic anemia. Sulat naman. Okay? And acute myocardial infarction. So these are examples. Okay? So what will happen in these cases? In AMI and hemolytic anemia. So this is intravascular hemolysis. So ano mangyayari guys? In AMI and hemolytic anemia. Of course, in these cases, in both cases, these cells will be destroyed. And if the cells will be destroyed, anong mangyayari sa laman nilang LDH? Kunyari, yan yung cell. May laman na LDH. Okay? Nagkaroon ka ngayon ng hemolytic anemia or intravascular hemolysis, acute myocardial infarction. So, nasira yung cells. Anong mangyayari sa nasirang cells? Mare-release yung LDH o yung LD1. Diba? Kasi LD1 yung pinag-uusapan natin dito. Mare-release yung LD1. So, ano mangyayari sa level ng LD1 sa peripheral circulation? Okay? Kasi nga, di ba, na-release, nagkaroon ka ng hemolysis, nagkaroon ka ng myocardial infarction, nasira yung cell, lumabas yung LD1. Ano mangyayari sa level ng LD1? Tataas siya ng bongga. Okay? So, kung tumaas siya ng bongga, anong mangyayari sa ratio ng LD2 to LD1? Mababaliktad. Okay? Yung LD1, since tumaas to, the LD1, magkakaroon ka na ng flip pattern. The LD1 will be greater than the LD2. So, yung LD flip pattern na yun, flip pattern, okay, haba that is seen in disorders of the cardiac muscle and hemolysis of red blood cell. Okay? I hope that is clear ha? Clear ba? Sana clear ha? Okay? Sayang mo ng laway. Okay, let's go back to our PowerPoint presentation. So I hope this is clear. In ANI and intravascular hemolysis, the serum levels of LD1 will increase to a point at which they are present in greater concentration. mas mataas na yung concentration nila as compared sa LD2. So, ano mangyayari? Magkakaroon ng LD flip pattern. Instead na LD2 greater than LD1 in the serum of a normal individual or a healthy individual, magiging baliktad. Mas mataas na yung LD1 kaysa sa LD2. Okay? Okay, slide 27. So this flip pattern is suggestive of acute myocardial infarction. Okay, pero yun nga guys, how can you determine flip pattern? Only if you measure the levels of the different isoenzyme. Kailangan mo naman ng isoenzyme na fractionation of the isoenzyme or measurement of the individual isoenzyme, which is not usually performed in the clinical laboratory. Okay, because we already use the troponin, which are more sensitive and more specific. When you say sensitive, we determine through positive. Okay, so it measures individuals who have the disease. Specific through negative. Okay, ulit-ulit, diba? So LD is not specific again to cardiac tissue. Why? Because it is found in various organs, okay? And is not preferred for the diagnosis of dying, okay? So the objective is not preferred. So what will happen in hemolyzed serum samples, guys? Ano mangyayari kapag hemolyze ang samples? Can that result also to LD flip pattern? Yes. Okay, bakit? Kasi hemolyzed serum sample due to error in phlebotomy or overcentrifugation, so that is extravascular hemolysis, it will also result to LD flip pattern. Okay? Kasi nga marirelease yung LD sa my serum. So, tataas yung LD level as relative to the LD2. Okay, so the LV flip pattern that is seen in myocardial infarction and in hemolytic anemia. Nakakagulat. Guys, wait lang. Okay, so the LD2 is never found in the skeletal muscle. Okay, though the LD2 is the major isoenzyme in the sera of healthy individual, kaya nga the LD2 is greater than the LD1. Okay, in the sera of healthy persons. Okay, so LD2 greater than LD1, nandiyan pala siya. So LD3, elevations of LD2 occur most frequently when with pulmonary involvement, therefore in lungs, and are also observed in patients with various carcinomas. Okay, so cancer that starts in the skin or in the linings of the organs. So LD2, LD3, LD4, these are LD cancer markers. Okay, most especially or predominantly the LD3. Okay, so even in acute leukemia, so there are increase in acute leukemia, in germ cell tumor, in breast, and in lung cancer. Okay, so LD4 and LD5, they are primarily found in the liver. Okay, liver and skeletal muscle with LD5 being the predominant. So, mas madaming LD5 sa liver and skeletal as compared kay LD4. LD5, that is the greatest clinical significance in the detection of hepatic disorders, okay, or disorders of the liver. Disorder of skeletal muscle will reveal elevated LD5 levels as depicted in the muscular dystrophies. Okay, so in Duchenne muscular dystrophy, CK, diba? Highest elevation, if you remember. Okay, so LD5 moderately increase in viral hepatitis, okay, cirrhosis, but markedly increase in hepatic carcinoma as well as in toxic hepatitis. So LD5 is elevated together with the appearance of LD6, probably representing hepatic congestion due to cardiovascular diseases. Okay, Therefore, the presence of the LD6 may reflect liver injury. Because of this one. So the LD6 may reflect liver injury secondary to severe circulatory insufficiency. The LD5, okay, LD5 has undetectable level in the heart, red blood cell, and renal cortex. Okay, so last of the enzyme, the LD6. Dapat na niyang ano, LD. Okay, so that is an alcohol dehydrogenase. So according to studies, LD6 has been present in patients with atherosclerotic cardiovascular failure. So it is believed, therefore, that the appearance signifies a grave prognosis and impending death. Malapit ng mga to. Char. Diba? So LD6 represents an alcohol dehydrogenase enzyme that is also elevated in drug hepatotoxicity, obstructive jaundice, as well as in patients with arteriosclerotic failure. Pero huwag nyo nang ilagay yung mga diseases associated with elevated level of LD6. Okay, but please remember that this is an alcohol dehydrogenase and its presence signifies grave prognosis and impending death. Okay, so naka 1/3 na tayo. So this is slide 33 out of 98. Pero baka madami lang akong blank. Okay, dami lang blank. So that is until 93, but I'm not yet done editing the last part. So that's for the first part of our discussion on clinical chemistry. I hope marami kayong naintindihan and marami kayong natutunan. And again, um, you expect for a blood quiz next week, guys. Yes, kasi imagine the coverage. Yeah, sobrang haba. Pero kaya nyo yun. Okay? Amen. In Jesus' name, amen.